Welcome to Herbal Medications. Complementary health approaches, or CHAs, are increasing in popularity in America because people want ways to improve their health and well-being or to relieve symptoms from diseases or the side effects from their treatments. CHAs are interventions that are not typically part of conventional Western medicine, but are still being used. Nurses are increasingly being asked to know about CHAs and to administer them in the healthcare setting. Because of this, nurses need to have some knowledge about CHAs, especially the common types of herbal medications being used. Regardless of what herbal supplements we may give, nurses must be aware of the fact that herbal supplements are not regulated by the FDA for safety, effectiveness, or purity. They are regulated as dietary supplements, not medications. Therefore, they can cause serious adverse effects and drug interactions, but they don't have to be tested for them. They are absolutely not safe for use during pregnancy because they have not been tested in pregnant women and don't have any known issues of what they could cause. If our patients choose to take herbal supplements, we need to educate them to really do their research on the potential side effects and interactions. And we do know some of them now, but we don't know all of them. And they need to check with their provider before starting to use them. Also, buying herbal supplements from a reliable source and not Amazon is best. GNC is a great store to buy supplements from because they do test their supplements and they do evaluate their purity and safety. Milk thistle, St. John's wort, echinacea, ginseng, vitamin C, and glucosamine chondroitin are the most commonly used herbal supplements. People use milk thistle to help with their liver. It's been shown to treat liver disorders like cirrhosis, hepatitis, gallstones, liver toxicity, and to clean the liver. Not all studies have shown milk thistle has any actual benefits, but it's thought that it helps reduce free radicals and reduce inflammation. Milk thistle cannot be used during pregnancy or lactation and in people with allergies to chamomile, ragweed, and chrysanthemums. One positive side effect of milk thistle is it can have a laxative effect, but it can also have serious allergic reactions. As nurses, we need to assess people taking milk thistle for liver issues, as the people most likely to take it have liver issues. This includes assessing for jaundice, altered level of consciousness, edema, ascites, elevated liver function tests. And we also need to educate people taking milk thistle to not use alcohol. Echinacea has been used to prevent and treat bacterial and viral infections like colds, flus, bronchitis, UTIs, and to promote wound healing. Echinacea is contraindicated in people with autoimmune disorders like multiple sclerosis, AIDS, and tuberculosis, as this supplement stimulates the immune response. Echinacea has side effects of drowsiness, fatigue, headache, nausea and vomiting, and allergic reactions. And there's a lot of research that shows echinacea does not work at all. And next we have vitamin C. Vitamin C is a very important supplement for our bodies. In fact, if we don't get enough of it in our diet, we can get a disorder called scurvy. When I'm discussing vitamin C right now, I'm not talking about the vitamins that we get from our diet. I'm talking about the use of vitamin C in higher doses than the human body needs. Vitamin C has been claimed to cure cancer, prevent asthma symptoms, and even cure diabetes. It's even being researched for its anti-inflammatory potential in sepsis. Many people like to take high doses of vitamin C to prevent colds or lessen the severity of a cold, but over 30 clinical trials and 10,000 participants failed to show that it did anything for colds. In fact, research shows that getting dietary vitamin C has much more benefits to our body than the supplements. We get our vitamin C from fruits and vegetables, especially citrus. So if your patient really wants to take vitamin C supplements, tell them to eat an orange. St. John's wort is a commonly used supplement that does have implications for our nursing practice. People use it to treat mild depression, relieve skin inflammation like wounds and burns, and to decrease tumor size. The side effects of St. John's wort include dizziness, sleep disturbances, hypertension, nausea and vomiting, abdominal pain, and interacts with alcohol. The major issue with St. John's wort is it has major drug reactions with some very commonly prescribed medications like antidepressants, migraine medications, benzodiazepines, warfarin, digoxin, statins, seizure medications, and birth control pills. If our patients don't know about the serious reactions, they could end up pregnant, they could have increased seizures, or they could form blood clots. Glucosamine and chondroitin are commonly used supplements to help people with osteoarthritis. Glucosamine has been shown to stimulate cartilage and synovial tissue metabolism, and chondroitin has been shown to be a building block of articular cartilage. Together, they help joints. These supplements are usually made together in one pill, and the side effects of these include heartburn, nausea, diarrhea, bleeding, allergic reactions, constipation, and can increase blood glucose level in diabetics. Glucosamine and chondroitin are contraindicated for use in pregnant and lactating people, as well as people with shellfish allergies. We need to avoid using it in people taking anticoagulants, antiplatelet drugs, NSAIDs, and cephalosporins, as these drug interactions will increase the risk of bleeding. And to be effective, they have to use it long term. It's not a short-term fix. They're going to be taking these supplements for a really long time. And lastly, we have ginseng. Ginseng is a supplement commonly used to improve physical and mental stamina, and it's been used for centuries. Ginseng contains antioxidants that may reduce inflammation, improve memory and mood, and boost the immune system. It's also thought to help sleep and enhance immune function. Ginseng is contraindicated in pregnancy and lactation, manic depressive disorders, psychosis, hypertension, and asthma. In addition to these, we need to use it in caution in diabetics, people taking anticoagulants, as it does interfere with platelet aggregation, which is the stickiness of the platelets. Ginseng also interacts with warfarin, MAOI inhibitors, immunosuppressants, and caffeine. Ginseng side effects include insomnia, nervousness, agitation, hypertension, tachycardia, diarrhea, amenorrhea, vaginal bleeding, fever, and Stevens-Johnson syndrome. If diarrhea does occur, the patient needs to stop taking the ginseng, as it could be a symptom of hepatitis, which has been known to occur with its use. And this is the end of herbal medications.